Joining us is Beaver Hudson, Emergency Psychiatry Coordinator at Sydney's St Vincents Hospital. Beaver, violence within healthcare facilities is an increasing phenomenon. Why is this so?
Look, it certainly appears to me that we've got more people turning up, so there's high demand, there's a lot more volume in the emergency department. I think there's a changing expectation within society. And ultimately I think that there's a bigger use now of alcohol and other drugs that we never saw in the past.
What kind of incidents confront emergency department staff?
The worst, I think, is obviously physical acts of violence, but damage to property, threats, verbal abuse. These obviously have a huge impact on the way that nurses and doctors conduct their business.
What effect do these incidents have on staff and their ability to do their job properly?
Well, of course, it detracts from being able to deliver life-saving treatments, which is what the emergency department is about. Naturally, impacts of sick leave also affect us, because when people do go off sick, it means that somebody else has to cover their shifts. So the workload expands.
But these acts of violence, do they actually affect traumatised staff?
Oh, absolutely, absolutely. And of course, they're also there to try and protect patients. So, it's not what happens to them, it's also if we witness or are involved in acts of violence between patients, or another patient gets injured as a result of some sort of event that's occurred in the ED.
Can duty of care be compromised in dealing with violent patients?
Look, in some ways it's a difficult question to answer, but certainly in my experience and here at St Vincent's, no, I wouldn't say that was true. I think that's because we have a coordinated response, it's a collaborative effort, and it utilises lots of skills and specialties that deliver care here in the emergency department.
Do staff need special training to deal with security risks and violence?
Absolutely. I think that's critical for all staff, whether you be an administrative worker with minimal clinical contact or a frontline clinical worker. That obviously ranges in expertise from being able to identify or recognise the early signs of a potential risk, right the way through to managing acute acts of violence, whether that be as a result of illness, mental health, intoxication problems, or whether it's simply criminal behaviour.
Finally, Beaver Hudson, what points will you be touching on in your presentation to the Hospital and Healthcare Security and Safety Conference on the 26th and 27th of November in Sydney?
I'll be talking about the systems and strategies employed at St Vincent's to maintain a safe environment for our staff. I'm going to attempt to demonstrate how cooperation, collaboration and coordination can bring about a safe and effective emergency department environment for staff, patients and visitors to our ED.
Thank you, Beaver, and we look forward to your presentation at the conference.
Thank you very much.